Welcome to the Singularity Syndicate podcast, where we bring together leaders, researchers, innovators, and intellectuals to discuss transformative technologies shaping our future. I'm Naja Faysal. Joining me today is Amit Jain, CTO of Personify Health. Welcome to the program, Amit.
Hi, Naja.
So, can we start with describing Personify Health and your role as a CTO?
Yeah, so at Personify Health, we are in a mission of changing lives. We want to bring healthcare benefits and well-being together on one platform to all our member users globally. What we really do good is actually providing that advanced personalization for every member globally. In 190 countries, we have users all over the globe who want to improve their lifestyle, their well-being, their behavior, their activity, their way of actually working with health plans and understanding their benefits and how to actually deal with the complex healthcare system, right? And not just being able to understand all of that, but also engage within their workforce, also take help of coaches, guides, what is needed to actually improve your life. So at Personify Health, we bring that end-to-end digital door in terms of the healthcare platform, which allows both well-being, benefits, claims, navigation, and so many other functionalities you need to actually deal with a complex healthcare system. My role as a chief technology officer here at Personify Health, I'm responsible for all of R&D and development in terms of building our platform, our products, and delivering that seamless user experience to all our users globally. We are very heavy in cloud, multiple clouds actually, in terms of our platform, but our resilience in terms of delivering that seamless user experience for millions of users logged in all the time is fundamental in terms of driving that engagement with our member users globally.
So, just to give context to the listeners, Personify Health used to be called Virgin Pulse.
We are transitioning from the core Virgin Pulse brand, which was center and core in terms of well-being and navigation and advocacy. We have merged with the largest TPA company in US today, HealthComp, and combining HealthComp in terms of benefits, claims administration, payment integrity solutions, claims education, and all the support system needed. We bring the two together in terms of one platform. So Personify Health is overreaching in terms of creating that disruption, in terms of bringing that one seamless user experience for our users. So when you come to the platform, you're getting the best of the two worlds. You're getting benefits and claims administration. You have clinical coaches on a phone call away. We're not talking about an AI bot. We're talking about humans actually answering clinical questions, uh, as well as well-being advocacy and coaching, which is available to you. So understanding navigation of like your benefits and basically going through that journey of your personal well-being, your family members, and yourself. I think it is important we try to enable that for users, but bringing that together between Virgin Pulse, the core platform, which was already doing well-being and navigation for all the users globally. We are bringing the healthcare side of the world where we have benefits and claims administration coming onto the platform. So it's a plus B, but the vision is significantly bigger and broader in terms of how to scale it for millions of lives on our platform.
Right. And can you give us some idea on how big is the team at Personify Health and how big is the user base?
Yeah, so as a combined organization, now that the merger is already happened several months now, it's almost like we are in the fifth month now. We are a workforce of 3,000 plus people in terms of our employee presence in terms of full-time employees, excluding contract employees on the platform. In terms of, I would say we just had Thrive, our client conference last week, and Chris Malek, our CEO, presented a number that 20 million plus lives are on the platform, which technically means you have 1 out of 5 every self-insured individual actually on the platform. So it's a pretty big, impressive number, and I think we are going to continue to grow as we bring more and more users. We bring the platform globally, allowing every large enterprise to have global populations come on the platform. Meaning, if you are a large Fortune 500 company, you will be able to bring your global workforce actually on the platform. And the top banks are on the platform, the top technology companies are on the platform. There's a lot of names you can actually see on our website who are actually on the platform. But the big difference is we are able to bring their global populations, meaning you have population in Asia, you have population in Australia, you have population in Europe, you have population in the US. You are able to bring all the workforce together on one platform to engage and actually be engaged in an active manner, right? You can have global challenges around activity, other kinds of individual challenges, holistic challenges, and challenges which can actually improve that social engagement as well as workforce improvement globally. And we are able to deliver that in 21 plus languages today. We are the only platform in the world which can actually deliver healthcare and well-being with that scale for a large population across the globe in so many languages today.
So, speaking of challenges, healthcare, we all know that it's heavily regulated, and you are delivering services across many nations, many countries, with all different regulatory systems. How are you managing all of that? And how long did it took you to be able to deliver that service globally?
Very good question. I think if I look at our history of the organization going from the Virgin Pulse side as well as HealthCom side, we have acquired and merged with a lot of organizations over the last 15, 20 years of the history of both companies. I think if you look at sort of like the IP which has been brought together from different products and solutions, you're probably looking at 20 plus companies actually, which actually make Personify Health today. So it is a wealth of engineering as well as subject matter knowledge which has been built over the years in building these products and solutions. But in the last few years, we have been accelerating into our cloud presence, building the high availability and scale across the globe. I think it is very important to understand when you are talking about healthcare, you're HIPAA certified, you're SOC 2 certified, you are GDPR compliant in Europe, as well as you have data regulations globally. So we are thoughtful about it. We are very, very strong in compliance in US and Europe, and we want to strive for more globally as well. Currently, we run our implementations in cloud in US and Europe heavily, primarily because those are the larger employer bases. But globally, as things progress, we are technology neutral in terms of being able to scale in every geography region.
You were keen on using the word humans delivering the service. As you know, we're all in the middle of the generative AI revolution. So why is the focus still on human delivering these services?
So we have a lot of GenAI and AI-based projects internally. We deliver all our advanced personalization. I want to put like a clear disclaimer. We run hundreds and hundreds of predictive models for giving that advanced personalization, which is also AI, but it is not Gen AI, right? So predictive models for giving you that advanced personalization to every user comes with a responsibility that what we are actually giving you is 100% accurate. It's 100% accurate. It is not 99.9%. It is not 90%. It is 100% accurate. And when we want to deliver that level of satisfaction and accuracy to our users, you don't have choice of making mistakes, right? You're talking about personal conditions. You're talking about how to actually deal with a condition. And we don't want hallucinations or any generative model actually going out of the way and not being accurate or being persuasive and trying to make you do something wrong, uh, where we have like real lives basically who need to have that direct communication. So we provide generative AI based plugins for our internal workforce where we have other business which can leverage that in a more thoughtful way, but we don't want to put our members at risk, right? When it comes to members at the clinical centric conversation, the LLMs have actually not achieved that level of maturity yet. 90% accuracy is good from a research point of view. It is not yet ready to actually put in front of member users who are not clinically savvy. I mean, they are not, if you're putting it in front of a doctor, he knows, am I getting a right answer or I'm getting a wrong answer?
So, speaking of AI, can you explain to me what are the different AI components within the service that you provide? And could you help me understand, like from the user's point of view, interacting with Personify Health, what are the key features that your app provides?
Right. So if we start with the member's journey on our platform, um, it can be any user, but as you basically use health plans for having insurance coverage, the same way you're coming on the platform for well-being as well as healthcare. Uh, you start your journey as part of, first we confirm you're an eligible member and you have the eligibility to be needed to have a secure access and all of that. But your member journey actually starts with certain inputs around your health, right? It goes from information we receive from the biometrics associated with the devices you're using. It could be wearables, it could be blood pressure, it could be other things, right? So we cover 1,000+ devices to provide input around everything which you are doing in terms of the activity. But then it comes to your healthcare centric questions, and you may be having a condition. You may want to prompt that as part of a survey input or a question input, setting up your profile. We get some of those inputs. But then we also get inputs from your claims or input coming in terms of your visits to doctor, and some of that passes through how the claims information is having some of those condition information. Now, these are just data points. This is not AI yet. When we curate that personalized journey for you, which is real in terms of your current state as of today, not as of Amit 10 years ago. And from a current state, whatever conditions or whatever situations I'm dealing with, they are an input in terms of my personalized journey. That personalized journey goes through condition-centric predictive models. It goes through AI models, which are heavily machine learning models, which are run at scale for providing that individual journeys. Each of these journeys could actually end up using a lot of different models, a lot of different machine learning models, where my conditions, my behavior, my anxiety patterns, my sleep patterns. So it is not just that we are talking about diabetes and we're talking about a specific chronic condition. I could be having a backache, and why I'm having these symptoms. I'm obese. I mean, different parameters which are clinically as an input, as a data point, help us trigger some of those predictive models and build that personalized journey for you. Uh, and we run like 1,000 machine learning models to actually provide that. So that's one large aspect of AI. The second aspect of AI is how we want to enable our workforce as well as our member users. So when member users are talking to the platform, right? I want a support access. I want to have an answer around my benefits or some question I have. Initially, we initiated with an AI-based chat interface, which allows you to actually have a lot of questions, self-troubleshooting, self-help, which is available. we bring data points in terms of our certified knowledge base, which is clinically certified and technically correct to be able to answer those questions. If we can answer those questions, we'll try to give you that answer through the AI chatbot. But if we want you to actually talk to an agent, or we want you to talk to a coach, we're going to actually do that. We're going to say, okay, let us come connect you to a human, and we'll take you there to actually help you through that process. What we do very different is blending human with digital, right? So that is very, very critical and important for us. For the 350 plus coaches, which are actually part of our workforce, who deal with all these different conditions, everybody's like, they provide a support system, which is very, very true in terms of dealing with particular situations as individual person needs. I mean, if you were asking a doctor's appointment, you know how hard it is to get actually an immediate appointment. It's not that difficult to actually get a coach to actually help you deal with some of those situations. And we hear tremendous number of stories. I mean, since COVID, I mean, things have dramatically shifted. Uh, People's anxiety are at different levels, mental conditions, and so many different scenarios where you need support and help. Uh, we really, really make a difference and actually bring that to our members.
So, as a technologist, you mentioned that AI or generative AI is not ready with, the hallucination problems. Do you think we're going to be ready soon to fully replace humans when it comes to coaching or medical guidance and healthcare providing?
Yeah, so I think we are still far from that. I think there is a lot of progress on Gen AI in terms of providing generic answers. I think we'll have to put guardrails in terms of the conversations, what we should answer versus what we should not. But in terms of the clinical guidance to uh, users who have no clinical understanding of any condition or medications, I think we are still at least 2 years away. There's a lot of progress. We have probably accelerated by 6, 7, 8 years in terms of this journey. Things which should have been in 2030, I think we have accelerated so fast. We'll probably see it in 26, but I think we still are 2 years away from making it real for our users.
What's emerging technologies or trends you're watching or you're keeping an eye on? And how do you balance innovation with your operational hustles? Because I know that you have a big team to run. So how do
Yeah.
you manage these two things?
Well, we have 600 plus engineers roughly who work to build this platform and deliver everything for our users. I think it's important to constantly innovate. Of course, we are focused in leveraging a lot of AI tools and technologies, but the developer productivity is a huge improvement with Gen AI enabling a lot of co-pilots for our engineers to be able to write code faster. Uh, so yes, we are seeing a lot of development frameworks actually evolve faster. More focus in the last 12 months, I would say, has been towards improving the development tools and then making the lives easier for developers. We also see that for our corporate workforce, for our coaches, for our customer support teams and everything over there. You're seeing a lot of the AI-based tools, Gen AI-based tools actually helping productivity improvements. And not to forget, when we talk about content and how we want to build content and generate content, there's a lot of Gen AI based tooling which is improving that engagement as well as content generation. Productivity wise, I think there is a tremendous improvement. Development tooling, there is a lot of improvement. Security and observability, I think there's a lot of improvement in how to run stuff and how to debug and how to solve issues. It's improving quite a bit, and we are seeing those performance and productivity improvements across the board. We have different targets for different functions. We run an AI steering executive board, watch into every POC to every R&D effort happening in adoption of different AI tools and technologies. We've seen like a lot of bot build out over the last 12, 18 months. we've been doing a lot of automation and acceleration of automation across the board as well. So uh, I would say there's a huge amount of progress, and in a way, we are transforming to the next stage of a lot of software technologies and platforms where we can actually deliver all of this at scale. With probably we would have needed 20% more workforce for doing the same. Because of all these changes, we are able to do a lot more with the same size of the team.
Curious to know if you're plugging in, if you're using the OpenAI models versus like Google or other platforms. Can you share anything about that?
Yeah, so we have OpenAI in a few things internally, but we are not using OpenAI. In our experiments, we are seeing a better performance with Claude 3 and Llama. I think Claude 3 is definitely a huge improvement against GPT 3, 4, and even in terms of compute utilization, it has shown a huge improvement. So we are leaning towards some of those in our foundational model integrations. In terms of our development stack, we are using a lot of development around AWS Bedrock, very close development in terms of data robot-based LLM ops build out, building the RAG pipelines in some of these stacks is very critical, as well as how we are integrating with the corporate platforms around Salesforce and everything else outside that. So Snowflake with a lot of those APIs is also helping us integrate with more GPU availability in terms of how we want to use and leverage GenAI models. So uh, I I would say we are still being nimble about it. Things are evolving, so it's okay to assume that there's going to be changes and there's going to be more changes as time progresses. But the more transparency is there in these foundation models, the better it would be for development teams like us to be able to basically appreciate more of these advancements.
Do you worry about jobs to be lost? And do you think a lot about the philosophical implications of this technology on society?
I absolutely think, I mean, there's we are sort of like going through a transformation across the industry. That means the education system should actually adapt as well. Society at the large should adapt as well. And I mean, White House has a AI policy for the first time, right, in place now. But uh, how will the community at large is going to embrace this, right? Our workforce, our job choices will evolve. It needs more understanding of these tools and enablement. So I think society at large has to embrace these tools, understand how the implications, privacy and choices. But at the same time, it's not like the jobs are going to get lost. Jobs are going to evolve in terms of a more improved workforce, which knows how to actually leverage these tools and technologies. And at the same time, given the acceleration in this transformation, more jobs are going to get created because more use cases are being created, more enterprise use cases exist. I mean, if I look at the list of things, we could keep working on 100 things and we will not be done in the next few years. So we have actually been recruiting a lot of engineers, but end of the day, the it has to have some commercial viability to be able to address the costs involved. But yeah, I think the jobs are actually going to transform in the way the market is going to evolve with more Gen AI adoption.
I'm recently heavily consuming a lot of Eastern philosophy content, and I wanted to ask you if you ever think about machine consciousness and whether this is even a possibility, and whether you think AGI or the way they define AGI is going to be something that's we're going to see in the next coming years.
I do think we'll see it in the next coming years. It's not real today. I think we are a little far from that. There's still a lot of noise, but uh, I think in the next 2 years, we're going to see more smarter execution, which is better than what a human can do because we have crossed those we can run it with billions of sort of like data points today, and that is changing the way how we think about that intelligence being built. So uh, 5-7 years down the line, absolutely, I think it's very possible. Maybe 10 years, but it's not going to happen in the next 1 or 2 years. I think we're still far from that.
Yeah, but what does an AGI would look like to you? And is
Yeah.
it conscious? Should we start preparing bill of rights for
No,
these AI
I think
systems?
it comes down to, right? It comes down to uh, how we want to build policy and governance as we are building this, right? Because if we don't teach good ethics and good discipline in terms of what's it to be human, and what's right and what's wrong, that definition of ethics and privacy and governance, and I think we have to introduce a lot of that. So when you go to AGI and you expect, okay, we're going to start suddenly getting surprised with uh, unexpected results, that's going to be dangerous, right? If it is not in the right sense. So good and bad, and if it gets used for evil reasons, I think that is going to create problems for society at large. So as leaders, as technology leaders, we also own the social responsibility as well as a moral responsibility of doing it right and actually building the right platforms and right infusion of those ethics, privacy, and governance into our AI framework. So when KGI becomes real, I mean, it is more educated, it's more human than we want it to be, right? And it is more right than we want it to be. So if you don't think it that way, it's going to become a huge challenge.
Right, but last question, would it be conscious in your definition of consciousness?
What is conscious, right? It comes back to what is conscious. And if we say conscious is a combination of these things, there is a thoughtful brain behind, along with senses and understanding of the nature, the surroundings, the context. Uh, if we have all of that, then the conscious would be as real as human. I mean, it's possible. I don't think it's out of the realm of impossible, but it's going to take some time. It's going to get there, but we have to make sure it is the right conscious.
Amit Jain, thank you so much for this interview. I really appreciate it.
Thank you, Naja.